Hello, Dr. Jane and class. My name is Ijama Ekeleme. Um, Welcome to my presentation for week 11 PowerPoint uh, class assignments on change implementation and management plan. Okay, my topic is on the importance and benefits of communication in a workplace. Effective communication at work is the most important issue for the success or failure of an organization. Communication is a key to job success. Authentic communication helps to build trust between management and staff. If communication is not effective, there might be fighting or conflict among the staff. Work will not be done well. The organization will not be able to convey their ideas and organizational goals. This slide is on justifications and positive impact of change in a workplace. Good and effective communication will result in improved productivity. It will lead to job satisfaction, fewer conflicts, positive relationships, work gets done more efficiently, and people understand each other better. This slide is on the stakeholders impacted by the changes. Stakeholders include everybody that comes into the organization. Everybody includes the staff, from the staff to the residents of the facility and their family members, to the CEO, nursing staff, managers, CNS, therapists, social workers, kitchen staff, cleaners, maintenance staff, and also even the vendors that come into the facility. This slide is an identification of change management team by title and role. In the nursing home, we have the administrator, who is the CEO in charge. He is in charge of all the affairs of the facility. Then followed by the director of nursing. She is in charge of the nursing affairs. We have the physician, who is the medical director of healthcare of the patients, for the healthcare of the patients. We have the social worker, who helps patients and families navigate the process of illness from hospital to recovery. We have representatives from the therapy. They see to the strengthening of the rehab patients. We have nursing managers that assist the DON in running the affairs of the facility. The dietitian sees to the nutrition of the patients. Then we have representatives from the maintenance department who see to the structural needs of the facility. We have representatives from the certified nursing assistants who see to the physical needs of the patients too. This slide is on plan for communicating the changes proposed. Proposed changes have to be properly and effectively communicated to staff, otherwise one would have worked in vain. Consider the best communication system to use. And what are they? We have the face-to-face communication through e-services, which can be done weekly or monthly. We have the handbook that can be consulted when in doubt. Newsletters that can be printed either weekly, bi-weekly, monthly, or as needed. We have the email, which is the fastest way to communicate if they have their personal email address. And then we can communicate these changes through communication boards that are placed in strategic places. The final slide is on risk mitigation plans for proposed change. People tend to resist change. Moreover, if that change entails responsibility increase. To mitigate this, you need to seriously engage in managing impact of putting people in line. You have to involve people early in the process. Be clear, concise, and transparent about what is changing. Training is never enough, so be sure to create appropriate training schemes and schedules that should be executed as close to the change date as possible. And make sure that the staff receive training before the change is executed. Finally, the importance of good and effective communication in a workplace cannot be overemphasized. For any organization to succeed, effective communication model must be implemented. Thank you.